So great to have the opportunity to speak with you, Claire, and good to meet you.
Well, and you too. I've been on and off seeing the different DSA interviews you've been doing, and just the whole focus on bringing downtown together. We live in this incredible city, and so it's got to be such an incredible position you're in to just bring so many passionate people that care about community together, especially in a time like this. I mean, normal times, but.
Yeah, we're just trying to listen and learn and share how the coronavirus and the health and economic impacts have affected different organizations and industries and sectors. And you certainly lead a very special and unique organization headquartered in Seattle and SightLife. And I wonder, maybe before you speak to how you've had to adjust and pivot, if you can maybe share a bit around the mission generally and the state of your work pre-COVID.
Yeah, it's been a dramatic shift. So SightLife is a nonprofit. We were founded and we've grown up in downtown Seattle, and so this tie to DSA is pretty special. SightLife's work actually started 50 years ago by the Northwest Lions organization, and so these were volunteers in the community that cared a lot about sight and hearing for local Seattleites. And what they would actually do is when there was a death in the community, somebody would call one of your local Lions who was a volunteer, and they would actually come to your house or the funeral home, and they would recover the eye to then take it over to the UW. A lot of times they would call a local state trooper. The state trooper would then take the eye over to the University of Washington, and a cornea surgeon would prep the eye, remove the cornea from the eye, which is like the glass surface on the top of your watch, and then transplant it into a patient that needed sight restoring surgery. So our roots in Seattle are really historic, and it's been really neat to see the organization grow over the past 50 years to not just serving our local community and employing so many people in the state of Washington, but also growing to be the #1 organization fighting corneal blindness around the world. It is the 3rd largest driver of preventable blindness in the world. There's about 12.7 million people suffering from preventable blindness, and 98% of them are in low and middle income countries. So we do a lot of extensive work in those countries, as well as providing corneals for transplant in the US. So COVID for us actually started way back with our operations in China. So it's been an interesting ride for us, especially as it swept through some of our international work and is impacting areas like operations in India. But then to be at one of the epicenters here in the United States, in the state of Washington, and going through it personally with so many of our families and employees impacted, but also just recipients locally that are trying to.
How did you have to adjust in China, and when was the first sort of sign that your operations there were going to be impacted?
Yeah, great question. So our employees in China had started reaching out in the January timeframe when we were seeing it in the news. And a lot of just traditional discussions about trying to figure out what it was and what was happening. Because we work in the healthcare industry and in hospitals and ophthalmology in particular, a lot of the doctors and surgeons that we work with we're starting to have questions. Our plan a lot of the time is to train surgeons, corneal surgeons in these countries, so they improve their technique or use more innovative surgical techniques that help the patient's outcome. And so normally we bring a lot of people together sponsored by these hospitals in China, and we're really starting to get a lot of, wait a second, we're not sure what's happening, what the spread is, let's put a damper maybe on some of these trainings. And what was very interesting is before they've been really reticent about using technology like we are to do webinars, everything needed to be in person. We've seen that dramatically switch. But our employees immediately started working from home. And then it was very interesting to see this, not only closure of hospitals that was happening, but this distrust in the healthcare system, this scare of individuals of going to a hospital, even for an eye surgery, because they are afraid they might get COVID. But what's been really interesting is to also have employees that have been part of the healthcare regiment that was deployed and quarantined around China, which is very different from how we did it here, and hear their stories about living through that type of more strict social lockdown. but then also how quickly they've seen their society kind of come out of it. So we've been able to watch our surgeons go back to work, corneal transplants kicking up very quickly. And that return has been really interesting. And we have weekly calls with our international offices. And so everybody's always interested in what are we learning from China? How is it impacting India now and all of our work in India? What are we doing in the United States? And we have kind of this microcosm in the healthcare world of what we're sharing and learning. It's been really interesting.
Yeah, you have a pretty unique perspective, and you've got to track a bunch of different places and what's allowed and what's not allowed. And how has the sort of the headquarters and your operations in Washington been affected, and how have you had to adjust?
Yeah, it's really been fascinating. Because we saw what was going on in China, and in a past job, I ran disaster response for Microsoft. And so this wasn't my first pandemic.
Yeah.
Although managing it on a much smaller scale, our organization is about 177 employees worldwide, slightly different scale from Microsoft. But I had been through H1N1 and the swine flu with the WHO and a lot of global pandemic responses. And so this one very quickly, starting on March 2nd, we started putting in business continuity plans, getting everyone working remote. Our HR job did a great job of sanitization stations and beginning social distancing. And we started tracking on March 6th, just making sure with all of our employees, we had a tracking system of who might be coming down with a fever, who would they come in contact with. So we were able to move remote really quickly. We do have essential workers, because even though there was a ban on elective surgeries on March 18th, we still can respond to emergency cases. And so if someone has an eye infection or an ulceration that is an emergency case, they still need a cornea. But that ban on elective surgeries dramatically kind of shut off 84% of our revenue right away. And that was really interesting. And so we did have to furlough employees. About 60% of our workforce is furloughed right now with the ban on elective surgeries, and everybody else took a hit in pay. And so everyone went into reduced pay. The key thing that we've always led with in this time is family first. We chose not to furlough, for instance, our staff in India, because they have no social safety net. There's no unemployment, there's no health care. So it's been really important to us to take care of our employees right now, the health and safety of their family, make sure no one is left without healthcare at this time, which is a pretty scary time around the world. And then just keep real transparency. I think just as a business leader, I've never chosen to be so transparent on our financials, on the decisions that we're making. There are times even our HR people said, you wouldn't traditionally do this. And we just, this is really untraditional times.
All the old rules are thrown out, right?
Yeah, there's so much uncertainty that at least locally in our company, we can control whether we play into that or whether we give transparency and certainty where we can. So we've really leaned in that direction. But we have 95 employees in the state of Washington, 87 here in Seattle. So a lot of our employees are in a hot zone. Those still entering hospitals, we've really worked on making sure we've got PPE. We're coordinating with the hospitals for everybody's safety, not just our employees. But it's been a really interesting time.
Are you leaning on a lot of your prior experience from leading disaster management at Microsoft? Is that the experience sort of kicking in and how you're leading your organization through this?
Yeah, definitely. Definitely having it not be my first pandemic was really helpful. Having a history in business continuity has been helpful, both in methodologies of time of uncertainty, of really be clear on what your intentions are with your organization and why you're doing what you're doing. Also, when it comes to this unknown of furloughing employees, you can kind of do death by 1,000 cuts, which adds to uncertainty. And I won't take that approach, having been through many of these. It's a matter of really look at what the community needs and what's the most safety. And we're going to cut deep, but we're only going to cut once. And then we're going to be incredibly transparent. We have weekly Zoom calls with everyone that's on furlough, and just be really clear on what's going on so that we can provide as much information. I don't think you can over communicate in a time like this. And as much transparency and as much compassion as we can. but definitely as far as business continuity planning, figuring out critical workforce, we've been a huge supporter and a fan of how the state of Washington has handled this whole thing. Nobody's going to do a pandemic perfect. That's one of the things that I've learned in crisis management. Nobody gets it right. But when you look at the macro level about how we've responded, one of the first to be hit in the United States, how we've really kind of quickly flattened the curve and continued a downward trend, leaning on accountability and empowerment of a society that really cares, a community that cares for each other. I think playing to our strengths, and it's not been perfect, but boy, the results have been really good. And even as a small business owner, it's tough, but I would much rather see us get through this quickly than a slow strangulation on the business, which we financially just wouldn't be able to recover from. So it's been hard, but we're very supportive of how things have been handled.
And I know you pursued some SBA loans in the Paycheck Protection Program. How was that process for you, and were you successful in getting some aid from the federal government?
Yeah, I think this is probably, John, to your question about where has your past disaster management experience came in, is I probably went into this time with my eyes more open than a lot of people, having been through many natural disasters in the United States and worked very closely with states and government, and just knowing what was coming. And so knowing that at some point in time, state and local government were going to kick in, federal would kick in at a much later date. There would be a lot of good intent, but because so many new processes and procedures were going to be in place, that a lot of these great promises were frankly also not going to pan out like intended. And that's pretty typical when you get into major disasters that a government or a state and local government aren't structured to.
Yeah.
So we
and then
did
you layer on the historic levels of demand, right, from companies and unemployed individuals. And
it's unprecedented. And so we applied for SBA and EIDL. We've only seen 10,000 of it. We applied for the full 2 million. No idea if that's going to come in. We did get our PPP last week. That was phenomenal in working with banks. But again, lots of changing rules. So as business owners, it feels like the rules are changing on a regular basis, but banks and legal support have been so generous with their time. I can't tell you how many different free webinars I've been in with local banks or local legal counsels just saying, do the best you can. We realize all the rules are changing. We're all in this together. And I think it's just wonderful that everyone's leaning in, trying to figure it out, but there's not going to be the type of clarity in a lot of these new laws, new mandates that you would have if we were used to dealing with these kind of level of deployments on a regular basis. Yeah. And John, I think your wife's in healthcare, isn't she?
Indeed.
You probably are on the front line of this. What's her experience been?
Yeah, much reduction in clinic visits, and they've been doing some telemedicine, but certainly a massive slowdown in her dermatology practice. And we saw the news recently around the University of Washington and the challenges that they're facing with their finances. So we need to sort of save our healthcare system twice, one by not overloading it, and then the next by investing, so we can help organizations like you continue to do the important work you do.
Right. And I think, we work very closely with so many local clinics, so many local and private surgeons, University of Washington. And one of the things that I love about our city is even though we're all taking this dramatic hit and we're having to impact people that we love, our families that work for us, our employees, our businesses, our patients, consistently what I hear from the state of Washington and so many of those in those clinics is we're still doing the right thing. This is lives we're saving by doing the social distancing. It's our community that we're trying to keep healthy long-term. It's a huge economic hit for us, and we hope it ends really fast, but how do we take this super seriously? How do we follow protocol and rules so we can get through it faster? And that's really heartening.
And never have to do it again, we hope, right?
I'm hoping so.
Yeah. How can people help SightLife? How can the community be supportive of your mission going forward?
It's a great question. For me, I would say the best thing the community could do is keep taking social distancing seriously. Keep the strict protocols. We are in I look at Jay Inslee's COVID updates, and even though we're seeing the numbers, flatten and start to decrease, don't lift up too early. Continue to do social distancing, continue to wear the face masks. Don't go out unless you have to. Find ways of supporting the community, but do it smart and do it effective, because the best way to support your community is to actually follow the rules so we can open up safely and securely. If we open up too quickly, if we take this in too relaxed of a measures, we're all going to spike right back into an area where we have to do lockdown and shutdown. And small businesses like ours will really struggle with even keeping our doors open for a second wave. Just like many others, as a nonprofit, we immediately started a COVID relief fund. And so if you go to sightlife.org, there is a page for COVID relief. This does help us kind of keep a skeleton crew on, and hopefully as quickly as possible, we will be able to, as the loosening on elective surgery starts, people can come back into the clinics, people can get those sight restoring surgeries.
Well, I really appreciate the opportunity to connect with you, Claire, and learn about the incredible work your organization does. I always feel so proud to learn more about organizations that have their roots in the middle of our city, but have an impact across our world. It's something we should all be proud of, that you're headquartered right in downtown Seattle, and also appreciate just hearing your leadership perspective around leading the organization through this challenging time, the importance of transparency and communication. I think those are great lessons for all of us that are leading organizations through these uncharted waters. So I look forward to meeting you in person when we can get back to doing it.
Definitely.
It was a great pleasure speaking to you virtually today.
Well, and Jonathan, thank you for the work you're doing. I can tell you, as a business leader right now, one of the most valuable things I have is finding different ways to connect to what our other small business leaders doing at this time. We have so much to learn. So it's really valuable for me to tap into your voices that you're taping. It's been really instrumental. So thanks for keeping such a vibrant community going. And I think it's connections like these that really help propagate that even in the hardest times. So thank you guys.
Yeah, agreed. And thank you again. And I hope you continue to stay healthy, and same for your team and staff, and be well.
Yeah, you too.